Um, my name is Barbara Gwynn. I'm the legal services developer for Community Living, Aging, and Protective Services, which is part of course, DHS. Work with Nadine. I'm sure you've met Nadine at this point. And so she had asked if I could actually present to caregivers, because of course there's always a lot of legal things that happen whenever you're in a caregiving situation, whether you're a caregiver for a child, or you're a caregiver for an adult, or you're a caregiver for like a disabled individual. There's always a lot of stuff that happens, and there's a lot of questions that come up. Now, in the past, we've always tried to just kind of cover some of those issues that you might encounter and try to just say, well, here's this situation or that situation. And the reality of it really came home in the last year with this pandemic, that really what people need to know is they need to know how to get legal services. Most of the time, people who are in a caregiving situation, they already know if they need to get an advance directive, or they know if they need to try to get guardianship, or they know if they need to try and get a trust established. What happens is then the question becomes, how do I affordably get the legal assistance that I need to make that happen? So that's actually what we're going to be looking at today. Is we're going to be looking at some of the different options that are out there for caregivers and care receivers to actually get affordable legal representation. So the first one, of course, legal aid services. That is our partner in the state of Oklahoma for our Title III legal services. They are throughout the state. They have a main office in Oklahoma City and another main office in Tulsa, and then they have branch offices throughout the state. If you are over the age of, I believe it's 60, it might even be 55. They don't do means testing, as far as like they're not going to be looking at how much income you have. However, they are limited in the types of cases that they handle. So for instance, if you have a case like a medical malpractice, or somebody has done shoddy business dealings with you and you're attempting to try to get your money back, those probably are not going to be suitable for what legal aid does. They basically are not going to be getting the big money back. So if you have a case that has like a money claim on it, it's probably not going to work. Now, having said that, they also do provide a lot of assistance if you have things that, like you're working through some of the other local service groups, whether they be part of DHS or if they be part of the independent service groups. They can help with, for instance, rental assistance, mortgage assistance. They can help you with utility assistance. They can actually help with a lot of the different resources that are out there to help keep people in place in their home and doing well. So don't hesitate to call them. The worst they can tell you is no. And we all hear a lot of no. So the reality of it is they've got a lot of resources themselves, and they often can, if they can't help you, they might be able to send you looking in another direction for somebody else who might be able to take on the case if they can't. So one of those organizations that I know that they refer to fairly frequently is Oklahoma Legal Connect, that you can find on the web at oklegalconnect.org. And that is actually a cooperative organization of several legal assistance organizations and groups that work to find legal assistance for people who are low income, that have civil legal problems in Oklahoma. Again, they're probably not going to be representing people for big money cases. They're not going to get you a $100,000 payout or anything, but they'll be able to help you with getting your guardianship paperwork completed, being able to help get your power of attorney recognized. They're going to be able to help you. We've seen them do things like help negotiate whenever there is a conflict between like a landlord and a tenant. So there's a lot of options just with these two right here, where they can actually help a lot of people with the day-to-day stuff. The Oklahoma Bar Association will not recommend an attorney to you. However, they will tell you if an attorney has been disciplined or sanctioned. They're also pretty good about if there is a recognized legal category and you've got attorneys who like to work within a certain category, we may join one of those organizations within the Oklahoma Bar Association. So they might let you know if the attorney that you're working with is part of one of those groups. There's also a lot of research at the Bar Association website. And I apologize, I keep getting the message that we might be having some internet issues. So if you can't hear me, I do apologize. There is a lot of information there, a lot of research there. The website is actually geared up to two different audiences. One is for the public, and they have a lot of stuff on there as far as like, well, what does this mean? What does this recent ruling mean? Where can you find out information about this law that you've heard about? They have a lot of good guides, like how to file for your guardianship if you're doing it for yourself, or, you know, different things like explaining what a do not resuscitate order is. Lots of good information. The other people, of course, who use that website are attorneys. And so there is a lot of cross-check on there. Most of the stuff that's for attorneys is going to be under a password, so you don't have to worry about if you're reading something that's not intended for you. If you can access it, you are allowed to read it. All right. Now, one thing that a lot of people do not realize is that we actually have 3 law schools in Oklahoma: University of Oklahoma, the Oklahoma City University, and the University of Tulsa. All 3 of those actually have intern programs. Now, with the intern programs, what will happen is you'll have a second-year law student or a third-year law student who has been through the basics. They will have tested out for the rules of ethics and professional responsibility, and they will have passed the exam for the internship. You know, I like to joke around that lawyers like to call that the mini bar. Everybody appreciate I'm not even a dad, and I've got dad humor jokes. All right. You do have students who actually work with you as you're an attorney. They are working under the oversight of licensed attorneys. There is a group of attorneys who work just exclusively with the interns and actually help to walk them through the cases. And so this is another option that you can pursue if you wanted to possibly have representation and not just have somebody advise you on how to do things for yourself. Now, Title III services under the Older Americans Act, there's a lot of information that's out there as far as resources that can help people. We do try to go ahead and encourage them to talk to people, to talk to their AAAs, because they may actually have local contacts, like attorneys that have registered with them and said, I'm willing to do pro se representation, or basically charge either a small fee or no fee to actually help people with certain things. We have attorneys who will sometimes establish clinics so that they can help people with certain categories of cases. Before the pandemic hit, I know that we actually had several attorneys throughout the state that did guardianship clinics, where 1 or 2 days a week they would be at the courthouse, and all they would do all day long is help assist people who were filing their guardianships. So hopefully those will start picking back up again as we start making our way through the pandemic. There is the number here for the statewide caring assistance line. Please call, get in touch with your local AAA and see if they have any of those resources there. And then finally, I wanted to end with the information on how to contact me. I am an attorney. However, since I work for the state, I am precluded from taking private cases. But my job as the legal services developer includes working with the public and helping them to answer questions and help connect them to resources. So a lot of those resources you've seen, you know, in the slideshow that we have here today, and they'll hopefully will lead you on to that next step of getting you the assistance that you need. I have people who call me like every week because they're going through different things in their life with their legal situations, and they just want things to be explained. Now, that kind of bothers me a little bit because their attorney should be representing them and explaining everything to them. But I do enjoy talking about the law with people. If I can help explain something to you, this was, you know, that's a great thing for me. We also have current updated versions of a lot of the documents that you might need as a caregiver. We just updated the power of attorney for medical, which does not actually have statutory authority right now, but we're working to get that back. We did the power of attorney for property. We've got the advanced directive. We've got the do not resuscitate. We do have a few other smaller forms that can help in particular situations. If you just need a copy of a form, call me. I can email it to you. It's free to download and print for yourself. Or if you just want to talk through something and just say like, is this a legal situation? Is this something that can be remedied by going to court? Is this something that I need to have an attorney for? Is this something that I can represent on my own? I'm glad to talk to anyone. Please call me at my number there, 405-208-2048. And I apologize. I think I went over a minute or two, but I am finished and I'm going to bow out and let the next person jump in here.
Thanks, Barbara. I'm so sorry. I had to wrap up the session, the afternoon session, and
well, you're
how many
running an entire conference. I mean, you know, come on now.
well, and hearing Dr. Jordan, I don't know how many of you heard Dr. Jordan's story. I mean, I'm still wiping tears. It was unbelievable story. But anyway, everything turned out good, so it was a good story. But thank you, ladies, for kicking it off and moving forward. I hate to keep you all.
And I will see you later. Thank you very much for your time, everyone.
Thank you. I know you have to go. Thank you. Bye. Okay. So I don't know how much the gals shared with you real quickly. Were you told who was all presenting here in this?
No, Nadine,
Okay.
we just let her get started and then said we'd leave it to you to give the introductions once you got here.
That's great. No, I appreciate that. I apologize. Okay, so here are the presenters real quick, just to give you a quick overview. So Barbara already has gone. Next, we'll have Marianne Briscoe. She's with OKDHS Medicare and Medicines. Alexa Lee Griffin, she is with the OKDHS, and she's going to be talking about the area agencies on aging and the services they provide. Keith is going to be here. He's with the Oklahoma Health Aging Initiative. And then we also have Christy with the Veterans Administration. So we have a lot of great information coming to you. Just going to back out of here and let them talk. So Marianne, are you ready? You have to unmute yourself, Marianne. Can we unmute Marianne real quick? See if I can help.
And
there you are. There you got it. Okay. All right, take it away.
Now, can I share?
Yes.
I couldn't share a minute ago. Okay. I can now.
Okay.
I think, am I sharing?
Yep, you're good.
Hang on just 1 second. Let me get ready here. Okay, I think I'm ready.
Looks good.
Good afternoon, everyone. I'm Marianne Briscoe, and I work with the MIPA program. The MIPA program is the Medicare Improvement and Patient Provider Act, and the program provides for grants to state and tribes to help those eligible apply for assistance through Medicare with Social Security. The MIPA grant provides assistance to low-income Medicare recipients with their Part D premiums and their prescription costs. Okay, our focus with MIPA is on the federal program called Extra Help, which is low-income subsidy program. And this is a federal program, like I said before. And then the state administers the Medicare Savings Program, which we also call the MSP, which is a state program. And you can apply through that through OKDHS. And this is the program that could help save money on your Part B monthly premium when you've heard that your Social Security can be increased by $144. That's what they say on the TV. This is the program that they're talking about, your Part B, and that's through DHS. Okay, Social Security has identified those in each state with a list that they've compiled, indicating the number of potential eligible people for extra help. Now, they don't give us the list of people. They just tell us where they are. They're in this zip code, this town, this county, whatever. And then we have to use our outreach to go out and find them. And they tell us that there's 14,304 people in Oklahoma that could potentially be eligible for extra help. The average savings would be $4,900 per individual of those potentially eligible, which is $70,089,600 to Oklahomans if all were enrolled. So this is why it's so important for us to try to reach out to these people to help save them money. The benefits of the LIS Extra Help is it pays some or part of Part D premium. Get my tongue twisted around here. And it pays some or all of the annual deductibles, pays part of the prescription drugs, co-payments, and co-insurance. There's continuous open enrollment for Part D, and there's no late enrollment penalty premiums. If you don't, I'm sure you've heard that if you don't sign up for Part B, and if you don't sign up for Part D, when you do sign up for them, there's a penalty. Well, if you're in Extra Help, that kind of takes care of that late penalty. And then you can change the plan at any time. Okay, so do you qualify? There's two criteria for being eligible for Extra Help. The first is the income is the first one. If you're single and make less than $1,630 a month, you could possibly be eligible. If you're a married couple, you could get $2,198 a month and then possibly be eligible for Extra Help. The income is based on your Social Security, your veterans benefits, if you're receiving veterans benefit, any pension that you have from any previous employer where you paid in a pension and you're now getting monthly payments, they would count that income. Any earnings if you are continuing to work, railroad retirement benefits, and other income, like if you have rental property, and this is just an example, but all of your income would be based and counted on this for your first qualification. Okay, the second eligibility requirement for Extra Help is your assets or resources. If you're a single person, you can have up to $14,790. And if you're a married couple, $29,520. But they have some exclusions. Some of the exclusions for this program, the LIS Extra Help program, is they exclude the house that you're living in and the land that it's on, your vehicle, any back payment that you have from Social Security or SSI, your personal possessions, life insurance, burial plots, and your irrevocable burial contracts. Those are all excluded, and you do not have to count those as your assets and resources. When we take an application for LIS Extra Help, we also, we do that on the computer. We can do that with a phone call. So you would just need to call one of the coordinators, and I'll tell you who they are in a few minutes. But at the end, it also tells about some of the state programs that the beneficiary might possibly be eligible for. And that's what this tells you about. And you can apply through DHS county offices, or you can go onto www.okdhslive.org and make an application, or you can call this number 1-855-880-8003. And this is where you would apply for the Medicare Savings Program, the MSP that I was telling you that could increase your Social Security check by $140. Right now it's $148.50 per month, but that is applied through DHS. But we can once we take the application for Extra Help, we can guide you and tell you where you need to go from there to get extra benefits that you might qualify for. There's another, Medicare has finally kind of got smart, or a little smarter, and they have figured out that it's cheaper for Medicare to prevent a disease or an illness than it is to cure it. So they have set up preventive health care. And this is focuses on things that can help prevent you from getting worse. And it could actually save your life. So be proactive with your health and take advantage of the many preventive services that Medicare offers. No matter what your income or your resources, if you have Medicare, you qualify for these services. And many of these services are covered 100%. Some are covered 80%. Now, this is just kind of a sampling of some of the things that they have, like the annual wellness visit. This is extremely important that you go in every year and go in for your annual wellness checkup. And then the bone mass measurement, they can do, this kind of tells how often they can do that, unless it's medically necessary. They can do it more often then, but that's up to your doctor. A colonoscopy, you know, this is extremely important. This can save many lives by getting this screening taken care of. Anyway, that's some of the things that the preventive health will take care of. Here's a list of some of the, it's a sample of some of the things that are paid 80%. Medicare pays 80%, and then you would pay the 20%. But if you have like a Medigap policy or an Advantage program or something like that, you may not have to pay for any of it, or just your copay or something. But this is something you can talk to your doctor about, and you know, get his help or her input into that. But it is extremely important to be proactive in this. This is I'm going to tell you a little bit about Find a Plan. Now, I'm sure that most of you know everything there is to know about Medicare. I'm joking, because it's very, very confusing. But the state health insurance counseling program has an office called SHIP, and it provides Medicare beneficiaries with information and counseling and enrollment assistance. Now, they are not going to enroll you or sell you anything. This is a state insurance counseling program that just compares different plans and can assist you with this one pays this one pays that, and let you make up your mind after they've presented the different things that are available for you. And you can reach the SHIP office at 1-800-763-2828. And like I said, they're not going to sell you a plan, but they can explain the various options for you. Now this, as you can see, this is a map of Oklahoma and how we've divided it. The map illustrates how the state is divided. And with the matching numbers on the left represents the coordinators that are assigned to specific areas. We have 5 co-coordinators with the MIPA program, and we each work just part-time. But if you'll find your contact information listed, and you can find the person and their contact information is just below their name by color coding it with the part of the state that you live in. And you can call one of us and we can help you if you have any questions about any of the MEPA program or about any of the benefits that you might be eligible for. At the bottom of the map, there is a website, www.okdhs.org/Medicare and Meds. This is on the website. If you have computer accessibility, you can go on there and that might answer some of the questions. But if not, give us a call and we will certainly do our best to direct you to wherever you need to get you the assistance that you need for what. So anyway, that's all. Just give us a call and we will certainly try to help you understand the Medicare program, because like I said before, it is very confusing and we will try to explain it in simple terms. It's like I said, it's just not easy. It's a very difficult. You're working at the government. And when somebody asked me if I wanted to work with a Medicare program, I said, no, I do not. But now that I've started working with the MIPA program, it's really not as difficult, but you have to have somebody that can maybe explain it to you in simple terms. So give us a call and see if we can't help you. Thank you. Have a good afternoon.
That was very good, Mary Ann.
Thank
There are some questions in the chat, but Mary Ann, Elena, I just asked her to call you, and then
Okay,
you all can talk for sake of time.
okay.
We have 3 more presenters and want to be sure we get them to present. And I think her questions, you'll go into some depth with her. But
Okay,
they are
can she
good.
get
And
my
anyone else.
number? Can she get my
Yes.
number off of there?
Yeah.
Okay, great. Just give me a call. Thank you.
And anybody else that has questions, give Mary
Yeah.
Ann a call. She is fabulous. She knows this
And
stuff.
If
Okay.
you're not in my area, that's okay. We're not territorial. If I can help you, I can get you to Jean or Teresa or Marilyn or Sue, and one of us will help you. So just give one of us a call. Thank you.
Thanks, Mary Ann. You can unshare, and then I will.
Unshare. Hang on. I gotta figure out. I got it to share. Now I gotta figure out how to unshare.
There you
Got it.
go. You got it.
Okay.
You did great.
Woo!
Thanks, Mary Ann. All right, Alexa,
Woo!
are you ready?
Yes, I am ready. I'm going to share my screen. All right, can everyone see my presentation?
Looks good.
All right, so good afternoon, everyone. My name is Alexa Lee Griffin, and I will be presenting today on Older Americans Act Services, Title III. All right, so what are Title III services? Title III services are offered to older Oklahomans to avoid placement in nursing home facilities and to live independently in their homes. The Area Agencies on Aging, also known as AAAs, help local communities provide Title III services. The AAAs target resources to meet the needs of Oklahomans with greatest economic needs. Now we have a target population that we focus on, and these are low income, minority persons, persons that reside in rural or isolated areas with severe disabilities, limited English proficiencies, risk for institutional placement, and Alzheimer's disease and related disorders with neurological and organic brain dysfunction, and the caretaker of such persons. So who is eligible for our services? Well, an Oklahoman who is 60 years of age or older. There's no verification of income or resources. The services are provided at no cost, but donations are gladly accepted. Caregiver services for those caring for someone 60 years of age and older, and grandparents 50 years of age and older, raising a relative child 18 years and under, or who has a disability. Now you all will have access to this PowerPoint presentation. And if you click on the link, you can get more information of Older American Act services. So who would you have to contact if you're interested in getting additional information about our services? You can call the statewide caring assistance line at 1-800-211-2116. You can contact your local area agency on aging, and I'll give you the map with the locations at the end of this presentation, or you can visit a local senior center. So here are some of the services that Title III offers. We have non-in-home services, which are services that are offered outside of the home, and we have in-home services, which are services that are offered inside of the participant's home. So some of our non-in-home services are congregate meals, nutrition counseling and education. We have health promotion classes, legal assistance, transportation, and assisted transportation. Amongst our in-home services, we have homemaker, home delivered meals, home repairs, and with our National Family Caregiver Services, we have access to assistance, counseling, support groups, and trainings. We have information about services, supplemental services, and respite care. So our caregiver services are designed to maximize the informal support provided by caregivers. With our information services, we provide caregivers with information on resources and services available to the public or persons in their community. Access to assistance helps caregivers to use services and resources in their communities. Our counseling services helps caregivers in the areas of health, nutrition, financial literacy. It also helps people make decisions and solve problems related to their caregiver roles. This includes providing counseling to persons with support groups, caregiver training, and individual caregivers and their families. With our respite care services, it provides temporary care to an eligible person, 60 years of age or older, a grandparent 55 years of age or older who are raising grandchildren. Respite services provides a brief period of relief or rest for caregivers. Respite is provided in home of the older adult or the child. The caregivers must be at least 18 years of age or older to receive our respite services. So who is eligible for caregiver services? Is a caregiver who provides care to a frail or older family member who are 60 years of age or older and unable to perform at least two of our activities of daily living. These are also known as ADLs. So ADLs are eating, dressing, bathing, toileting, transferring in and out of bed or chair, or walking. Whenever an intake will be filled out, whenever an outreach worker comes to the home to do an assessment, and a written description of the caregiver's current situation must be given to the outreach worker. And this includes identifying the older person's needs for assistance due to his or her inability to perform specific ADLs, or the need for supervision due to the Alzheimer's disease or disability. So earlier I spoke to you about the Area Agencies on Aging, also known as the AAAs. And this is a map of Oklahoma. We have 11 area agencies on aging throughout the state. Here you can see which area agency covers what part of the state. And again, these are working links. If you click on the link, it'll give you each area agency on aging's contact information, address and address, and telephone number. So you can call them if additional information is needed. I want to thank you all for listening to my presentation. I will put my contact information in the chat if you all want additional information or if you have any questions on the presentation. Thank you so much.
Thank you, Alexa. That was great. Appreciate your
welcome.
time. I don't see any questions, but it looks like they know where to reach you. So very good. Okay. What you doing, Keith? Hello. You're in the office. Good.
No internet problem today.
That's right. Well, I'm going to step out of here and let you introduce yourself and take over.
Well, hey, good afternoon. My name is Keith Blazinski. I am an assistant professor of research, University of Oklahoma Health Sciences Center, but I'm also the associate director for what's called the Oklahoma Health and Aging Initiative. And I also am part of the leadership team of what's called the Oklahoma Dementia Care Network. And those last two are kind of what I'm here talking about today, focusing on a class for caregivers called Powerful Tools for Caregivers. We offer it through OHI via the Oklahoma Dementia Care Network, but it's a free class for anybody who's a caregiver. The website for the actual program is right there. And right when I get off my presentation here, I'll put some of these links in the chat for you as well. But this teaches you as a caregiver yourself to take care of you and your health and your well-being. Because if you don't deliver good care or don't take care of yourself, you're not going to deliver good care, right? You need to take care of yourself. It's very important. It's a six session program. It's once a week for 6 weeks, about an hour, 90 minutes. Usually it's during the day, but sometimes we experiment with offering it in the early evening. But it teaches you to do things like reduce your stress, improve self-confidence, manage goals, communicate feelings. That's really important. locate resources, and making tough decisions, right? And so the classes are offered through our staff at the Oklahoma Healthy Aging Initiative on behalf of the Oklahoma Health Dementia Care Network. So since we started doing this on behalf of the Oklahoma Dementia Care Network, we've had 26 six-week programs. And we actually have 2 master trainers, and we've trained some other people around the state. So there may be people nearby you who can deliver powerful tools if you can't get into an OHI class. We tend to average 5 or 6 people per class, per program, 6-week program, because we've had about 148 cycle through since July 2019. We generally offer this on Zoom because A, COVID-19 pandemic kind of forced our hand. B, a lot of caregivers find that this platform is a little bit more convenient for them to log in. You heard Alexa talking about respite. Well, sometimes they get that, or they haven't used it up for that particular period of time or something along those lines. So they need to be around the person they're caring for, but then they can take the class while they're on Zoom. Right now, we're kind of ramping down for the end of the year. So our calendar will fill up. OHI delivers a lot of different classes for older adults. It's not just this particular one I'm telling you about. There's also some classes for falls prevention, Tai Chi, and a class called Staying Active and Independent for Life. There's also a class called Healthy Brain, Healthy Mind we offer in terms of emotional well-being. And there's a few other chronic disease self-management type things we do as well. So our class calendars will start to fill as we enter into December, and our educators really start to fill up. But right now, we definitely have one on the books that starts January 12th, 2022. It will be 2 p.m. Via this Zoom platform. Please check these 2 websites. I'll put them in the chat so you can have them handy for you here in a minute. And we're also going to experiment with potentially having like an ongoing powerful tools all the time, but that's still in the works. So right now, if you're interested in anything that's upcoming, I've listed that for you here. And then here's some more websites. I'm going to put all this in the chat for you when I'm done, so it's there for you. If you want to call us, we do have a toll-free number, and we do have an Oklahoma City number that kind of will fan out to everybody around the state. So if you call 405-271-2290, somebody will take the message and then give it to the appropriate person to call you back. So with that being said, I will put my stuff in the chat. I will turn it over back to Nadine. I can take any questions if there are any. I do have a lot of static, Leah. It is my laptop, and I really, really apologize. So I am going to put as many of these things in the chat as I can so that it's accessible for all of you, and I'm working on the computer program problem.
Technology is great when it works, right, Keith? I know it's frustrating, but we do appreciate you being here, and thank you for all the great things OHI is doing for our family caregivers. We do value that. All right, so you can watch the chat, and you can see that Keith's putting some good information out there for us, and call him, and he can help if you didn't hear some of that. All right, looks like we have Christy on. Hi, Christy.
Hello, how is everybody today?
Good. I'm gonna, like I did with everybody else, I'm gonna step out of here and let you introduce yourself and take it away.
Can you hear me okay, Nadine?
Yes.
Okay. Hi, my name is Christy Pargeter, and I am one of the caregiver support coordinators at the Oklahoma City VA. I'm a licensed clinical social worker, and I've been with the VA for 13 years, so I have a lot of experience under my belt with the VA. At this time, I'm with the VA Caregiver Support Program and do lots of jobs within this program. But today we'll talk about one of the programs in particular. So, you know, the Caregiver Support Program was established in 2010 within the VA. The intent of it was to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. We want our veterans to be able to remain in the home as much as they can and provide a menu of programs and services to our caregivers to help support them. So today we'll talk about the General Caregiver Program. This program offers supportive services to the caregivers of veterans, whether they are a family member, a neighbor, or a friend. We offer here locally at the Oklahoma City VA things such as support groups that we meet either weekly or monthly, depending on the particular group that we're presenting. We have educational opportunities with our nurses and occupational therapists that present on different topics. And then we also have our national programs that we can facilitate and connect caregivers to. So today we're going to talk about the program of general caregiver support services and the menu of services that offers. So I think the first and most important thing is the Caregiver Support Program website. And in the slides, you will have the link to this as well. This website allows you to see all the different services and resources that our programs offer. It also gives some good caregiver information and educational things as well. We have caregiver education calls. This is through the National Program Office, the Caregiver Support Line, and they offer monthly telephone education calls for caregivers. And the topics range from specific caregiver needs like stress and burden to veteran topics that would be helpful for caregivers to learn. And they do offer audio recordings of these calls that can be found on the Caregiver Support website. The Building Better Caregivers program is a 6-week online workshop for caregivers of all eras who are caring for someone with dementia, memory problems, post-traumatic stress disorder, a serious brain injury, or any other serious injury or illness. The training is intended to help improve care and helping caregivers learn how to manage their own emotions, stress, and physical health. Caregivers can, as long as they are caring for a veteran, self-enroll through the link that's on the presentation. So for those that really like technology or are comfortable with technology, we have an anti-text system, which is a specific protocol for things like, we had one for COVID for a while, we have one for bereavement, we have one for caregiver stress and strain, and you get 2 to 3 texts per week that allow a caregiver to just be reminded of, it's time to breathe. Sometimes we forget to do some of the simple things that help us feel a little better. So it gives us some reminders, so that way we do those things on a more regular basis. We have a program called SAVE training, which is a suicide prevention training aimed to decrease veteran suicide. Trainings are held at a minimum of 4 times per year, typically each quarter of the fiscal year. Caregivers First is a program that we offer locally. I've been trained, as well as one of my colleagues have been trained to provide this. And it's an evidence-based caregiver skills training program that has the goal of connecting caregivers with each other and to resources to help them feel more confident, capable, and supported in their caregiving role. This is a program that I've really enjoyed being able to facilitate. It allows the caregivers to learn some information, to in every session have learn a new self-care skill, stress management skill, and then it also works on goals with their, that they may have with their care recipient. Either navigating the healthcare system, what do you do with a declining family member when their health is declining, their physical functioning is declining. And so it is a very helpful training opportunity. And then one of the last ones is the REACH VA program, and this is resources for enhancing all caregivers' health. There is 2 of us here at the Oklahoma City VA that are certified to be REACH coordinators. And these are individual sessions, typically 4 to 6 over like a 3-month period with the caregiver. Again, we go over specific topics such as all eras of veteran, post 9/11 veteran, dementia, spinal cord injury, ALS, multiple sclerosis, and PTSD. And so the caregivers again learn stress management techniques, self-care techniques, and some problem-solving skills. They get a really nice workbook that allows them to go back for years, months to come to review the information that they've received. All right. So there is no formal application to be enrolled in the general caregiver program within the VA. you would just want to contact our office or myself to either request additional information or be enrolled. And the veteran does have to be enrolled in the VA healthcare system for the caregiver to receive the supportive services. But that's something that I can help with as well. If a veteran is not enrolled in VA healthcare, helping the caregiver navigate the VA system, getting enrolled, and getting assigned to a primary care doctor. I will say that a veteran, if they are getting care in the community, they do not have to stop receiving that care in the community in order to get VA care. They would just have to see their primary care doctor one time a year. And, beyond our services, the VA healthcare system has a lot of benefits to veterans and caregivers that they oftentimes don't know or aren't aware of. And so here is my contact information that will also be on the PowerPoint. I've given you my VA cell phone number and my email address. And if you guys have any questions or would like to discuss anything further, please don't hesitate to give me a call.
Thank you so much. That is such good information, Christy. Appreciate your time with all that. I know you have a lot of resources that a lot of us don't know about, and we do appreciate you taking the time to share that. That's very, very good. Okay, well, it's been quite a day. It's been there's been a lot of information. I hope all of you have been able to join us the full day. If not, we are going to be putting the website on our okcares.org website. You'll be able to go there probably in about a week. By the time we get all the recordings together, we will have them posted. So we will have this one. And if there were other breakout rooms you wanted to go to, you could listen to the recordings of those other breakout rooms and just get all the information you can. That's so important. Need to know if Rhonda Ballard, are you on? I see Rhonda's iPad. Is that Rhonda Ballard? If you can unmute yourself and let me know.
Yes,
Are you Rhonda Ballard?
yes, I am.
Well, you just won our last gift card.
Thank you.
So
That's awesome.
congratulations. Just want to make sure it was you. So thank you for participating with us to the end. We do appreciate you. So again,
Thank you.
yes, those will get mailed to you, Rhonda. Again, the recordings will be at okcares.org. Please, you will be getting a evaluation to fill out. We do value your information and how you felt about the conference. And if there's anything we can do to improve it, please be honest. Let us know what worked, what didn't work. We want to make it bigger and better next year, and we need that input from you. You will be getting an email. And again, if you send in an evaluation, you are in another gift card drawing. So again, on behalf of the Oklahoma Caregiver Coalition, we want to thank you for attending the 4th Annual Family Caregiver Conference, Embracing Hope. We hope this did give you some hope and that you know that you are valued. We wish you all the best, and thank you for all you do. Hope to see you next year.